Morning. Today we talk about children and their welfare in the COVID times. Children have been home since March. They are super happy. No school, both parents at home, and lots of fun. But for parents, happy to see their children home, but it can be tiring to manage the energy bunnies. Also, they have worries about the school reopening, playing with friends, or any other medical issues. To answer some of these issues, I'm extremely happy to welcome Dr. Ravindra Chittal, eminent pediatrician at Lilavati and Hinduja hospitals. Dr. Chittal has been pediatrician at least to two generations. His clinic is mostly filled with mothers who themselves were under his care when they were kids. He looked after my children and their children, and I know that he definitely has a charm in dealing with children. How are you, Ravi? How are you handling the challenges of looking after the little kids in these times?
Very well. Thank you, Dr. Jagannath. And it's been really a pleasure talking to you and through you to so many of my patients and so many other people who have not been our patients also. It has been challenging actually. And well, along with the children, we are also locked in. Children are actually not very happy being locked in. Initially, yes, no school, no studies, no teachers, but now they're missing it because children get very physical. They need to be physical. Watching TV for a while, watching cartoon for a while is okay, but now they miss children. They miss the hugging and the pulling and sharing things, fighting for things. They really miss that. And really, in fact, a lockdown syndrome is very much happening. So many children, small, big, older children even. In fact, they have so many of psychopathological diseases. No physical illnesses, but symptoms are physical. The problem is in the mind. And that's really very difficult to tackle because how much can we explain? You put on the television, it's all depressing news. Everybody talks about wearing masks, washing hands, be careful, don't touch it. And children don't like being restricted. They want freedom. They want to go out. And that's exactly what is missing. And that's really sad because I have no idea how to tackle this through the parents. You talk to them, yes, they listen to you via media, on the WhatsApp, but I know they need children to be children.
I know. You're so right, Ravi. The childhood is about fun, about playing with friends, about doing all those things, pulling and tugging, and that social skills are so important for their development. And then, yeah, you're very right. In these times, I really don't know how the parents can really manage. It's a tough challenge. Let's turn to some points for discussion. See, children are really the focus of the family. Every parent would want to ensure safety, and also they realize that they can't keep them at home for too long. They have to play, as you rightly said, meet their friends, and also go to the school. Some common questions, if you can answer them. Can children get COVID? And if so, how is the recovery?
Children certainly are vulnerable to COVID as much as adults are, only because being homebound, they have less chance of direct exposure to from other children. But adults do go in and out, and if an adult can get infection, they definitely can pass it on to children. Children are very difficult to quarantine even within their house. If some adult, especially the parents, are COVID positive, it's very difficult to self quarantine and keep the child away. And children, when they need to be pacified, they need to be carried. When the child is infected, they pass on the infection to other people in the house. So children don't suffer from COVID. They are asymptomatic completely, but they are the one who pass on the infection. This whole infection spreads in the family through the children, even neonates. If a mother is COVID positive, there's a vertical transmission which passes on to the neonate. Neonate is completely asymptomatic. And I'll come to the fact of why they're asymptomatic, why children are robust, is because they are immunodeficient.
Oh, I
Remember,
see.
everybody is talking about boosting the immunity and stuff like that. It is not because of low immunity that you get it. When you get it, your immune system responds in a very aggressive way. And that's why adults behave so aggressively in the disease because their immune system is strong. Children's immune responses are muted. They don't have such a robust immune system to fight the infection. And when you fight the infection, you suffer. That's exactly why the disease does not become worse overnight. It happens over the time. After 1 week, the second week is the one where COVID positive patients become worse. When you become a little complacent, but that's when the immune system starts firing in. And that's why it's called a cytokine storm. Cytokine storm does not happen on day 1. It happens from day 7 to day 12. And this response is not seen in children. Because of the relatively weaker immune response to a disease, they are robust, their lungs are healthy, their immune system is relatively weak, and that's why they do not suffer. But they do pass on the infection, especially neonates pass on a lot of viral load into the stools. And stool becomes a way of communicating. In fact, we've had a report coming from UK where a COVID positive baby was admitted in the NICU, and all the babies in the NICU became COVID positive. Now, this child is not passing on, there is social distancing, but the stool transmits the infection through the air into the other babies. And those babies who are asymptomatic went home, and their parents and grandparents suffered. These are documented cases from UK.
I see. So that's a transmission by stool is one of the important modes in the pediatric age groups. Okay, so when you say the immune system is weak, it's something which is favorable for the children, right?
The immune response is muted. It's not that immunocompromised. They are not weak immunologically.
Yeah, I correct.
But once you get a disease, the immune response is not as aggressive as in adults, and that's why they're saved from the comorbid condition.
Yeah, but some people keep on hearing about this Kawasaki-like syndrome in children and all. Is it really common, or it's quite rare, and should parents be worried about it?
It's not very common, but it's not so very common either. But this is something that you look for. And here the children behave like adults do. After 7 days, the child is fine, ready to go home, but because his COVID-19 is still positive, they're kept in the hospital. 7th, 8th, 10th day, they crash. And it is a multimodal, it's a multi-organ disorder because it causes vasculitis. Kawasaki's is a disease not related alone to COVID, but we still don't know the cause of Kawasaki in general. But in COVID-19 situation, Kawasaki-like syndrome causing inflammation of all the blood vessels, small and medium-sized blood vessels, including the heart vessels, the brain vessels, the renal vessels, and multimodal involvement of all the disease. And that is seen. In fact, out of 100 children in Vadia Hospital, 18 children were Kawasaki-like syndrome. Now that's a big number. The UK number was close to 1 to 3%. Now Vadia is a hospital where children come in with a lot of symptoms. And that's in the sick children, 18% is probably a valid number. Not 18% of all the COVID positive, but 18% of sick children who require hospitalization symptoms.
So, I mean, can I say that it's not common, but it's something which you need to be a little wary of?
The pediatrician has to be wary. If a child comes with COVID positive symptomatic, we need to be very wary of the symptoms. Not so much the lungs like it happened in adults, but yes, we have a generalized Kawasaki vasculitis syndrome.
Yeah. See, as you rightly said, the children want to play around in an open playground and maybe in their housing complex with other children. Is there a risk, and what are the precautions to be taken? As you said that, if you ask them to wear masks and do that, they're not going to be happy about it.
In fact, unfortunately, all the children are not supposed to wear the mask.
Okay.
Below 6 years, they do a lot of hurt. Carbon dioxide rebreathing. They become hypoxic and they become hypercapnic, which you don't realize. And in fact, below 2 years, definitely not. We have small size masks available, but they are not meant for children below 2 years at all, and definitely up to 6 years. So social distancing is very important. Hand washing is very important. Going to the terrace when there are no other children may be safe, but you're traveling through an elevator where you have a virus hanging because so many other people have traveled through the elevator before you. Right. Likewise, when you go to a terrace, when you go onto the railings, you touch somewhere where somebody might have touched the railing before you. So the virus remains on a flat surface, metallic or non-metallic, for many hours. So touching those areas which might have been contaminated, the child can acquire infections. Going to a play area, because I know of societies which ration the area of play areas. For example, first floor will go at this particular time, third floor will go at some particular time. But sharing the equipment, sharing the toys, sharing the common play areas can be risky because you might carry infection. The children certainly will not wear masks. They will not wear gloves. And that's when you touch areas which are already contaminated, you really run the risk of carrying the infection with you and can get it infected into the house. So social distancing has to be followed very, very strictly. Travel in your own car. Don't travel public transport because children will not get the hands on the handles. Going by a rickshaw or a taxi, when you touch some area which had already been contaminated, you carry a risk of infection. So children may not suffer, but they really definitely get the infection back into the home. I know of many doctors who take precautions. Grandchild got infected and spread the infection to everybody in the house, and everybody was COVID positive. Luckily, they came out.
Okay, so that's a real risk that the kids can bring home, and then senior citizens at home, and they are the ones who are likely to get. See, Ravi, let me be frank. How can you ask a child to be socially distancing away from a playmate. Now, do you think that, having this hand sanitizers near the play areas so that constantly they are kind of washing or hand sanitizing, is it an option? What's a practical option?
It is a easy way out really, because hand sanitizer is important. Remember, this virus is a large size virus. 5 microns is a large size compared to other viruses, though it's an RNA virus. And that's why it can be masked by simple barriers like mask, gloves. It can block it. Secondly, it has a very thick fat layer around it. And only thing that dissolves fat is alcohol and soap.
Right.
Hand washing and alcohol definitely can remove the virus. So these are very simple steps.
Right.
Social distance, if it is not really possible, wear gloves, sanitize before, sanitize after. So you don't transmit to somebody else, somebody doesn't transmit to you. And of course, tell them don't touch your sensitive areas, like your nose, mouth, and eyes are very, very sensitive areas. They will not put screens. Like doctors need to wear screen because they are looking into somebody's throat or the nose. We need to wear a screen. But putting a screen on the child is difficult, and because through the skin they will touch the nose. Important part: don't touch your eyes, don't touch your nose, don't put things in your mouth. And hand washing before, hand washing after, or sanitize.
Okay. So this is something which the parents can tell the kids, and then I'm sure that they'll also understand, and they'll also kind of follow some of these rules. Now, what I take on from there is, this is something my wife constantly asks me, that, when can I go and when can I see my grandchildren, and, when can they come here or hug me? How difficult is this at this time, and what is your recommendation? This is a very strong emotional need from both the grandparents and the grandchildren.
And if it is difficult for the grandmother, it's 100 times more difficult for grandchildren. They want to hug, they want to smell you, they want to touch you, they want to go all over your body. They need it so much. What's difficult, Dr. Jagannath? I don't know how to break rules here and allow them to hug each other. Because remember, elderly people are more at risk than children. Children will not suffer, but then ultimately the adults and the elderly adults will suffer even more. I think FaceTime is a good option, maybe. If you need to travel, yes, you need to travel, but make sure that you are COVID negative. Here is the house. Nobody goes in and out of the house later on. It's fine. I mean, I know. I mean, you need to hug your grandchildren. It's so much therapeutic. So much really positive therapeutic.
But I think for our own safety at this point of time, till things settle down, I think we need to.
Yes.
I think that's most important thing. Now, there is so much, lots of hype or whatever it is about the diet, about the immunopotentiators. And I keep getting questions saying that, can they have some drugs for prophylaxis? What's your take on prophylaxis, and then this immunopotentiators and so many other things which are there in the market now?
One thing is, it's not a disease of the immunodeficient. It is disease of the comorbid conditions. So if you are diabetic, if you are hypertensive, if you are a cancer survivor,
No, for
if
the
you have
kids.
chronic lung disease.
What about the kids?
So the kids, no, I'm talking about adults. So that's why children are relatively safe for that way. Giving immunoboosters is a myth because it's a new disease, because nobody knows anything about this disease. Everybody knows what therapies to offer. I mean, we went through this before. We went through HCQs, we went to vitamin C, we went to vitamin D, we want to zinc, we want to haldi, we want to go amla juice. So many things. Like everybody has it's like treatment of a common cold. There are more remedies than the disease itself. So that's what happens. So it's like wishful thinking that something will work. Initially, it said because the hot weather in India is going to protect us. Didn't happen. The monsoon is going to protect us. It doesn't happen. It's basically the associated comorbid condition which makes you sick. So don't fall sick. Stay at home. And in fact, I'll tell you, Dr. Jagannath, initially there were many panic calls about illnesses and all that. But over the time, because of lockdown and successful lockdown, children are not falling sick. They're not getting the common colds and the coughs and the loose motion because they're having home food.
Right.
They don't expose them to other children. So no going to school, no carrying infection back home, so no falling sick. I only hope all the time they forget the pediatrician because they don't need pediatrician anymore. But that's a happy situation.
Yeah.
Children not falling sick because of lockdown. That's what exactly happened in New Zealand. New Zealand reduced the incidence. Now we are going through the Southern Hemisphere flu right now.
Right.
June, July, August, September is the Southern Hemisphere flu, which affects India, it affects Singapore, Malaysia, New Zealand, Australia.
Yeah.
And in fact, the vaccine which is available now is the Southern Hemisphere flu vaccine for flu. Now, New Zealand, because of the successful lockdown for COVID, also managed to reduce the incidence of flu. And
Right.
flu and COVID have a very close, association. What happened in the northern hemisphere in the month of December, Jan, Feb, March, where a lot of thousands of people died every day in China, in Russia, in the entire Europe, in Iran, and Dubai, because of two comorbid conditions,
Right.
which both of them cause cytokine storm. One is the seasonal winter flu, and second is the COVID-19.
Right.
At that time, Indians were very happy that we have robust immunity, we have been given BCG, we have the MMR, we are not going to suffer, and the virus is not going to survive in the summertime. No, because we did not have winter flu then. We're going to have summer flu now. If we read the numbers now, increasing morbidity and mortality has started now in the last 1 month. And that's because we had the southern hemisphere flu. So the way to stay away from a comorbid condition is protect yourself from flu. Stay inside the house. And if you can, take the flu shots to children and adults, and especially the elderly. Because these two comorbid conditions happening together is going to increase tremendous amount of morbidity and mortality.
Okay.
So my suggestions, and all pediatricians tell everybody, please take the flu shot this year.
Okay. Any questions on the flu immunization at this time?
Yeah, doctor,
Yes.
actually, I wanted to know, I have a 22-month-old baby at home. And one of the things that we were obviously very concerned about over this lockdown period and post-lockdown was, should we get her immunized? Should we wait? We in fact waited for her immunization for 2 months, and then we actually got it done. And, with this flu vaccination and the regular immunization, should we go? Should we wait? Hospitals, clinics? What is your recommendation?
This fear was all over the world actually, whether to give vaccinations or not, because going to a clinic which is full of sick children was initially considered a risk factor because social distancing is not possible. But then realized there is likely a risk of the vaccine preventable diseases might surgeon. So now the Johns Hopkins recommendation, and this is the international protocol, not to miss the primary vaccinations. That means vaccinations below 1 year, which includes your polio, DPT, hepatitis, and hip, rotavirus, and then MMR vaccine. These are mandatory. Then comes the booster at 18 months, which become mandatory. You cannot miss this. What you cannot miss, what you can afford to miss, are the non-essential vaccines like chickenpox and hepatitis A.
Okay.
What has also become mandatory not to miss is the seasonal vaccine. For example, the influenza vaccine has become so important for the given reasons I given earlier that they become comorbid along with COVID-19. So it is very, very important to finish the vaccinations in children because along with the COVID-19, you also run the risk of vaccine preventable diseases surging up, which is very likely to happen. So don't miss the vaccine. Now, there's a protocol which is recommended for vaccinations in a clinic. Sick children and vaccine children cannot be taken in together. You need to have complete social distancing. In our clinic, what we follow is every 15 minutes, one patient with one parent is allowed inside the clinic. Of course, the patient and the child is screened for fever, hand sanitized and taken to the clinic, finish the vaccine and go, then the next patient is taken in. This is extremely important because children cannot sit together either with other children who need to be vaccinated or other children who might have been sick.
Right.
So if you follow the social distancing, strict following of the rules, and then international protocol from Johns Hopkins, you will not run the risk of catching infections.
Right.
An influenza vaccine is recommended any child more than 9 months, along with the regular vaccines it can be given. It's a killed vaccine. It can be given along with the live vaccine or the other killed vaccines, including the MMR or the boosters, etc. So don't miss the vaccine. That's an important message all over the world. Do not miss the primary vaccination. Otherwise, we run the risk of running another epidemic holocaust of vaccine preventable epidemics like polio, and which has happened in Ghana. They have an upsurge of polio suddenly. Now, the only 3 countries in the world who had polio was Pakistan, Yemen, and Sudan. Now, there's an epidemic of polio in Ghana, and people are scared. People are worried.
Right.
These are vaccine preventable diseases, cannot afford children to run that risk.
So when do we take the flu vac now, the adults and the children?
The flu vaccine, the Southern, it has been logoed SH2000, Southern Hemisphere 2020. Now, this vaccine is available from the month of May till September. So anytime now, when there's a risk of getting the Southern Hemisphere flu, every child and every adult should take the flu vaccine.
Now, this is the time to, till September, before September, we need to take it. Great.
That's why they are expecting the second wave in December.
Okay.
Not in India, but that will happen probably in the northern hemisphere, because that's the time of the northern hemisphere flu. So we have a second surge of the comorbid condition of flu and COVID-19 coming in the northern hemisphere, back to China, back to Iran, back to Russia, back to entire Europe. So India will probably come in the recovery phase that time, and the northern hemisphere will suffer.
See, Ravi, if the flu is so common now, a child gets fever. Now, when do we say, okay, now this is something which is just a simple flu which is there running around, or it's you've not been exposed, for example. So how do you differentiate, or how do you manage this?
Yeah, I mean, very, very relevant question, because I get phone calls for the same thing every day. The child has getting fever, and initially we knew that fever was an important symptom of COVID-19, but now we know we can get COVID-19 without fever. That's a part. But when a child gets fever, normally influenza starts with a bang and comes peters off after 2 to 3 days and wears off after 5 to 7 days. A fever which is there to stay after 48 hours with worsening of symptoms at the upper respiratory or lower respiratory, or associated abdominal symptoms like loose motion, severe abdominal cramps, or in older children, severe backache. Now, these are the kind of symptoms you look for. Worsening of symptoms after 48 hours, where the flu is supposed to get better, COVID-19 becomes worse. Okay. Secondly, a child who is recovering nicely, you do a COVID test and COVID test comes positive. Fine. Self-quarantine, no medication except hydration and paracetamol. Older adults, at children more than 10 years, we give hydroxychloroquine, we give azithromycin, sometimes anti-flu medicines, we do give them. And of course, zinc and vitamins in a high dose, which is supposed to be therapeutic, which is useful. But after 70, the symptoms get worse. That's where the cytokine storm sets in, and that's one to watch for. So symptoms initially may be mild, get worse with time, or you recover and get worse after second week. Then you have to be extremely careful about when you land up with symptomatic COVID-19.
Okay, the testing is done if the fever is beyond 2 days, and
yes.
So not otherwise. Am I right in that?
Yes, and the fever should be humongous fever, not just 98, 99 fever, just a warm head. It could be just a seasonal virus infection, or it could be some other cause. But when you have a humongous fever, which doesn't respond, and fever in the middle of the night kind of fever, then you are very wary. This could be coronavirus.
Okay, so those are the kids who are to have a testing. Maybe now the rapid testing is okay with them?
Yes, rapid test is fine. Yes.
Okay. See, that brings to our question. We see kids are kids. They have some, urgent situations.
Yeah.
We have a question on that.
My daughter actually, about a week ago, she slipped and she slit her lip on the edge of the wall, and it just kept continuously bleeding, and we completely panicked because we tried to put pressure, but it just kept bleeding. And at that point the dilemma was, should we take her? Does she need stitches? What do we do? There are so many other I guess non-flu related, non-immunization related emergencies that can happen. What do you recommend, doctor, that we do in such situations?
Well, one thing, of course, connect with your pediatrician immediately. I mean, he'll tell you ways to stop the bleeding. And you can always connect on the video consulting. And in fact, right now, even Supreme Court has allowed us to do online consulting with medication prescribed. So one thing is to connect with the pediatrician immediately instead of trying home remedies. Try it first. Nothing works. Like children have had burns, spilling because of COVID-19. There's a thing about steam inhalation. So everybody in the house is taking steam inhalation, and children are very prone to get panicked inside the towel and spill it over. So many children have burned themselves. So what do? Don't panic. First, connect with the pediatrician. Secondly, if you need to take to a hospital, go to a hospital which probably could be COVID-19 or non-COVID positive hospital. Thirdly, even if you have a COVID positive hospital, you have certain areas which are called tent areas. In the hospital that I work in, we have areas outside the hospital dedicated for screening of the patients, which are not really teeming with COVID-19 patients. But again, social distancing is important. Where if somebody sees you, the person who's examined is completely with PPE, where this person might be exposed to COVID positive, but completely PPE protected person, doctor will examine you. So if you need to go, first thing is to avoid going to hospital as much as possible for valid anxiety reason. Secondly, if you need to go to hospital which is non-COVID dedicated hospital. That again, you will be screened. Third, go to a hospital which is close by, but it is a COVID hospital. Then you have to go to a non-COVID area in the hospital, which is called a tent area. the other patient will be examined and given the right treatment.
Okay. Thank you, doctor.
There are many patients who require hospitalization. Then what happens? Then you have certain holding areas in the hospital which are, of course, at risk because there may be many other patients. Some of it might turn out to be COVID positive. So you are kept in a holding area till a COVID becomes negative or a COVID test comes negative. Then you are shifted to non-COVID-19 area. So there are rules and protocols to be followed. So protection of the patient who are not COVID positive should not become COVID-19 positive just because they went to the hospital. So all these protecting protocols are there and they're being followed strictly.
But honestly, Ravi, just imagine the children seeing these doctors and others in these PPE suits. The entire the soft physical contact is lost. So I'm sure they'll be very, very scared about all these things.
Oh, they are scared of their own mothers wearing mask outside. They want to pull down the mask because inside the house they see the mother without the mask. Right. And when they are outside, they see the mother with the mask. They want to pull the mask down. And it's difficult to convince them. I'm your same mama, I'm your mama. But they want a same looking mama.
I know, that's true. Now let's turn to something about the schools, because schools are been closed, but now schools have to reopen at some point of time. So obviously there are lots of questions about the schools. We have possibly a youngest webinar participant to ask.
Yeah, Ivan. Hi.
Hi. Can I go to school?
Well, ask your teacher. Difficult, Ivan, because the risk of going out, the same risk goes into. I know you want to shake hands, you want to hug your friends, you want to do all that, but right now is the time to meet them online, meet them on the television, meet them on the computer, meet them on your laptop. Okay, you have to have online learning, you have to have online meeting with the friends. Okay, so I know you have to celebrate birthday in house and share it with everybody online. Okay, it's a difficult situation, I know, Ivan, but that's the way it is. Okay.
When will coronavirus go?
You ask me, I hope it goes today. But coronavirus has some different measurement, different calculation. He says, I will stay this month, maybe the next month, maybe next 2-3 months. I think with the rains going away, everybody is smart enough to stay at home. I think it will go away sooner. We're all waiting, Ivan. We're all waiting to go out and have the fun that we used to have before. But everybody has to be patient, stay at home, and hope the corona goes away. Stay safe, stay at home, okay? And wash your hands every time.
Thank you, doctor.
Bye.
Bye.
Now,
that's what children need, children, I tell you. Oh my God, they're really missing school. Not for the learning, but they miss other children in the school. It's so sad.
So what are the precautions if they go to school and parents want to go and see what's happening in the school? So what does the school do actually? If at all they open, say maybe a couple of months.
School in real time will be really difficult because children they do follow rules. But for example, they are supposed to file down the staircase when the school opens. But when the bell rings, you see children running down the staircase. They want to go and meet mama. They're missing the whole day. So children are the first one to break rules. So they do understand, they do follow. In fact, adults break rules knowingly. Children might break the rules unknowingly, but they do follow to a large extent. If you tell them don't touch the railing, you come down the stairs, they will really not touch the railings, I can tell you. And that's the risk of going to the airport, while going to the escalators and stuff. You have to hold on to the railing. Then that's where the infection takes place. Many people say, is it safe to travel in the aircraft? Aircraft is safe. Escalator may not be safe. That's the way it is. The same thing going to school. Going to school may be safe, but children should not break rules. And how many children are not going to break rules? One is enough to cause. And then you see how Ivan was touching the nose or putting things in the mouth. It's inevitable. It's a child behavior. So I think school is a long way to go. Online teaching maybe, but children simply fall asleep in front of the screen. But they need to have physical contacts. It's still difficult. Right. Now they're reducing the portions for the school and stuff like that. But anyway, some things need to be done. At least pretend we are doing the right thing. But I think social distancing demands that school should not open now. Like religious places should not open now. School should not open so soon. Okay. Not for the next few months. At least we send the dip in the curve, yes, only then maybe. Because remember, one case is enough to infect 100 people. One child can infect 30, 40 children easily.
So we need to be very careful about the schools.
Yes.
Online learning, whatever may be disadvantages in some senses, but I think safer for the children. Because
Yeah, but again, this online teaching is causing so much of eye problem. Children keep on getting red eyes, itching of the eyes, and it's very difficult. It's a normal new.
yeah, is the screen time going to be affecting their mental health also?
To some extent, yes. It's not a radiation, but they are so much into it. They don't give eye contact with adults. They're all the time into the screen.
Right.
Exactly the things we are telling children not to do. We're now encouraging to do screen time more and more.
Right.
So I think 2 hours, 3 hours is the upper limit. For a 5 and 6 year hour school timing, I think 2 or 3 hours is the normal expected screen
Right.
time.
Okay. So that's a challenge really. This safe normal, Ravi, the entire message is that if the society really takes care of these common things, it's good for them and good for the children. So together, I think we can kind of at least bring some kind of a control onto the onto the pandemic. A few small issues, otherwise that. What about breastfeeding in the newborn infant? If the mother is COVID positive.
She must breastfeed. Breast milk is not known to transmit the infection. She has to, of course, wash the hands diligently before handling the baby. But there is a antenatal transmission. There is a vertical transmission through the placenta from the visa RNA virus can easily pass on. Though it's a large size virus, it can easily pass on from the placenta from the mother to the baby. So baby is actually infected even prior to coming out. Transmission of the infection will be had from the mother's hand. So strict hand washing, wearing a mask in front of the baby, and desist from kissing the baby. Which mother will stop kissing the baby?
I know.
So that's like, so babies is a given that baby will be infected.
Okay.
And so baby has to be quarantined along with the mother. You don't have to separate the mother and the baby at all. And quarantine the baby and the mother from the rest of the family, because baby is going to be passing on the infection to others.
I know.
That's the important message, that the baby can breastfeed, but distance from the other people in the family so they don't get infected from the baby.
Right.
And baby will not suffer. There's hardly a baby who's sick. There's not been I think one case has been reported that the baby went into respiratory distress with X-ray or CT scan showing suggestive of a COVID-19 X-ray. But generally, babies are very robust lungs, so no problem.
Great. So what's closing message to the parents and the children?
Well, hope that this thing passes off as soon as possible. Till then, stay at home, wash hands, social distancing. And any suggestive symptoms, get in touch with the pediatrician immediately.
Thank you so much for all this information. I am sure that you are also looking forward to the time playing with children. Children, of course, are looking forward to playing with their friends, going to school. And I think, but together, if we follow the precautions, I think we can quickly bring a closure to this, and all of us will be safe to follow the safe normal. Thank you very much indeed, Dr. Chittal.
Thank you. Thank you. It's been wonderful talking to you.